Didn't set it as recorded. Okay, started now. Anyways, we didn't say anything really interesting so far. I will probably add a text in the useful files and in the text there will be a link to YouTube, and in YouTube you will find the video, because Ola doesn't have that much space, so I cannot post all the videos. And besides, it's not only me, there is also Stefan. If he wants to do the same, then I take all the space from him. So from this meeting on, you'll find a text file. You open it, there is the link. Assuming that you want to watch over and over again this wonderful video, or you want to show it to your family and friends, just to show them how fun is university, right? Anyways, so today we're going to discuss a bit on immune and orthopedic disorders. Usually I separate them because they are very different, but considering that we don't have much time, we will condense them in a single class. And that was also that was not related to coronavirus crisis. I had already them condensed in one class because we don't have much time. I would need to have all the semester with you to see really in detail everything, which I would love to, but they don't let me. So we are discussing these two very different groups of diseases, and as always, we will highlight the most common, or those that if you become a professional in exercise therapy, I don't know if you. Okay, I have a very quick emergency. Yes, I'm going. Maria, go. My wife hit her head and she has a sort of concussion, so I have to be behind the path of my kids. Give me a minute. Sorry, guys.
Ich habe eine Frage. Weißt du, was der Unterschied bei dem Group Practice zwischen 1 und 2 als Gruppe? Machen die ersten das Aufwärmen und die zweiten das Abwärmen?
Ich glaube, das sind zwei verschiedene Themen, oder? Oder nicht?
What's that? German?
Nee, ich glaube schon, dass die ersten das Aufwärmen, die zweiten den Cooldown machen.
I will have to go again.
Sorry.
No, I will have to go when she's done because she's in the toilet. But as I said, my wife yesterday night hit strongly her head and she has a sort of concussion. She vomited also. So we are keeping her under control, because if she's still sick tomorrow, we will have to go to the hospital. I didn't want to call off the meeting because we already called off last time. So just have to go back when she's done. She'll call me. What was the question meanwhile?
I had a question concerning the group practice. What's the difference between 1 and 2? If the first group is doing the warming up and the second one the cool down?
That was the original idea. Since we were going to the practice, to the hall to do the practice, one group would start, so would have to do the warm up, and the second group 2 would have to do the cooling down. At this point, it doesn't make any sense. I just want some activities, but in terms of activities, there are no differences. I mean, both will work on the same disorders, then obviously, and hopefully you will have different activities, so you work separately, you don't work together. But originally the group 1, group 2, the only reason was that you would have split the 1 hour in 2 halves. So half an hour for one group and half an hour for the second group. And obviously since the one group starts, would have the warm up. That's it. So now forget about it. You don't have to do the warm up, but just the cooling down, just the activities regarding the disorders that you are assigned to. It's taking really a lot. She's a number 2, my daughter. Okay, let's hope that they don't interrupt too much. Anyways, so today we're discussing, and I'm going to share you have the file already in OLAT, so I don't know if you have time to watch it, to check it, but it's immune and orthopedic. Let me share with you and see if you can see the presentation. Can you?
Yep.
Oh, okay. So I'm going to clean some bath and coming back, literally. Yes, I'm coming. So sorry, guys.
Wisst ihr, ob wir für Immun und Orthopädie was hochladen müssen oder jeweils nur, oder nur eins?
Müssen wir fragen,
Ja.
wenn er wieder da ist.
Meines Wissens nach müssen wir immer 2 Artikel hochladen und das soll immer 2 unterschiedliche Krankheiten behandeln.
She seems very happy now. So hopefully she got rid of everything. So guys,
I have a question. So shall we upload 2 different presentations for immune and orthopedic diseases or just one?
Again. Sorry, I couldn't hear well.
Shall we upload 2 presentations for immune and orthopedic diseases or just one presentation?
What do you mean presentation?
So
you mean the reviews? The reviews.
Yeah, the review presentation.
No, it's one. It's one. I mean, it's 2 articles. It's 2 articles for the full stuff, for immune and orthopedic together. Okay? Is that clear? And also next week we are going to see neuromuscular and cognitive, and these 2 articles for the whole stuff, not 2 and 2. Is that clear?
Okay.
I didn't think about it. Good question. Anything else? No, later. All right. So the first group that we're going to discuss is the immune diseases, and the immune diseases are basically active diseases in which there is an abnormal activity of the immune system. That does not necessarily mean that the immune system works less. In some cases, also that it's hyperactive, like it works too much. So when our immune system works too much, we have then issues of different kind. Obviously, you want the immune system to work in a proper way. When it works too much, there are typical cases in which the immune system attacks our body, like recognizing it as extraneous. Typically, the immune system attacks the agents that come from the outside, so that doesn't recognize as ours. But when it's hyperactive, it's overreacting, so it's reacting against our body. And then in other cases, there are other diseases that actually slow down our immune system, so we are more exposed. In many of these cases, and in the presentation, you have, for instance, the HIV, so the autoimmune disease. Precisely, you don't normally, a person who develops the AIDS does not die of AIDS, but AIDS reduces the quality and the ability of the immune system to face other problems that we can bump into. For instance, a cold becomes very dangerous because our immune system is sort of slow and not reactive. So even a simple cold that we would manage very easily becomes a problem, a complication. So you don't hear that people have died of AIDS, but have died because of secondary issues that came due to the reduced immune defenses provoked by AIDS, by HIV virus. So in terms of stats, let me move you here. In terms of stats, what the most important thing that you have to know is that they are, in this case, they are leading causes of death in younger people. So in younger and middle age, rather than cardiovascular diseases, pulmonary diseases that are more connected with aging, these type of diseases are more prevalent. So the prevalence, as you can see in the world, can depend a lot based on the disease, but there are some that are very, very rare. So 1 person every 100,000, and others are a bit more common, 500 person every 100,000. We are talking about rates that are low, but still significant. And as you can see, some of those diseases are increasing over the time, and for instance, 60% that from the 60% of the countries affected by immune diseases, 60% of all the countries in the World Health Organization, now we raised to 71, so it's spreading. 200 person every 100,000 are in Austria are affected or die by due to cancer every year, according to the statistics. Cancer is the most common disease in this area in Austria, even if it's not very high, the percentage of people who get cancer among Austrian adults. As you can see there below, according to the Austrian health system, the percentage is relatively low, considering also the comparison with other countries. 3.2% of morbidity rates is very low. It's a bit higher in men than in women. There is an explanation of that we will reach later, but it's the average percentage is very low compared to other countries. So as I said, the most common of these diseases is cancer, and also the most difficult to not, well, apart of to treat for doctors, also to for us to work with, for a simple reason. The reason is that there are too many cancers around. Like there are so many and so different, and even within the same type of cancer, so breast cancer, liver cancer, there are extreme differences based on how far it went, how big it is, what is affecting a part of where it's developing. So for us, it's the most complicated to work with because physical activity will change a lot based on individually, basically, based on the person. Guys, I cannot see you because I have the presentation in front of me. So if you have any question, just stop me, please. So it's a group of, actually it's not even a, cancer is not even a disease, a single disease, but it's a group of diseases. Like cancers are based on the type of cancer, based on the type of cells that start reproducing, but all of them have the same pattern. The pattern is that the body cells start reproducing uncontrollably, and they spread in the surrounding tissues. Some of the information on cancer basically can start anywhere in the body. Really, there is no part that cannot be affected by cancer. Any cell usually does that activity, the activity of reproducing and substituting old cells. So usually we have, when the cells have a life that is way shorter than our own life. And when a cell becomes older, then it's substituted by a new cell. So it divides and the new cells grow and work better. Obviously, this process becomes slower and slower as we age, but that's normal. The problem is when there is this division of cells activates even if the cells around them are still working efficiently, or when the cells start dividing because of a need of dividing, but cannot be cannot be stopped. There is a basic biological process. The basic biological process is that these cells have as a receptor, and this receptor usually after they divide for a certain amount of times, when it's enough, this receptor receives a this receptor get in contact with a substance that we produce and stops dividing. But in the case of cancer, it doesn't happen. This receptor doesn't work, or the cell doesn't stop reproducing, even if we send a message to stop. And so it starts dividing uncontrollably. Not all the tumors, though, are cancerous. Like there is a difference with, and I'm sure that you heard that there are good tumors and bad tumors. The good tumors usually are cells that are easily recognized and easily removed, and they don't spread around. The cancerous tumors, instead, that they have the ability actually to spread around the body. So, for instance, they start developing in a certain area, and then parts of them get into the blood system, into the lymphatic system, reach another place in the body, and there they start developing again. One of the main problems is that these cells are not specialized. You know that each part of our body is specialized. So we have cells that when we are born or when we are growing inside our mother's belly, our cells are still not specialized. There is a huge part of research that works on non-specialized cells to use them to, for instance, try to regenerate nerves. You know that nerves so far is one of the tissues of human body that we don't know how to regenerate. So if you get a paralysis, it's impossible basically to recompose the nerve. So a lot of the works that in research are working on is on non-specialized cells that can still become specialized in a different tissue. In the case of cancer, these are non-specialized cells, but they remain non-specialized. So also for our body, it's difficult to recognize them because they don't have a specialization. They are not cells that are specialized in liver cells, or they are not cells that are specialized into heart muscle cells. They are general unspecialized cells, and it's very difficult to recognize and destroy them and stop them. So they start reproducing. They ignore signals from our body that tell them to stop, and so they start the apoptosis. The apoptosis is they don't start the apoptosis. Apoptosis is that process that makes the cells stop doing their activity. So this is a bit of the bio, the general bio. Then we would have to go into each different cancer to see exactly how it works in each different part of the body. It's just too long. It would take a lot of time to discuss about it. But the most important thing on the causes is that there are people, I don't know if you know this, there are people who don't do anything like bad or harmful for their life and they develop cancer anyways. And then there are people who, I'm sure that you ever heard the story of that guy who smoked 3 boxes of cigarettes per day and never had lung cancer. This is an old story that you hear all the time. There is a part of truth in that, and the part of truth is that the development of cancer is. Can you hear me well? Because I have kids around crying. Can you still hear me well, guys?
Yeah.
Yes.
Okay. Because the other day they crashed the party and they started shouting close to my phone and my microphone, and nobody could hear me. But in case you stop me, please. So there is an interaction between genes and external agents, meaning that you may be in contact with external agents that trigger the development of cancer, but not always you develop cancer, because it also depends on what kind of genes you have. There are some genes that are called proton cogenes, tumor suppressor, and DNA repair, for instance. If they are not functioning well for us in our body, we may not even be aware of it, but when they enter in contact with an external agent that may trigger cancer, they trigger cancer. So in some cases, a person smokes 1 cigarette and develops cancer because genetically they are prone to that. And there are other persons who smoke a lot, never have a lung cancer because genetically they are stronger in that sense. So in general, there is a part of truth in that story that the person never developed cancer, even smoking 30 cigarettes per day, although probably developed other diseases. And the point is precisely that there is an interaction with the genes. The external agents that may trigger cancer are physical. They are usually research divides them into 3-4 categories. And the main categories are physical, so like radiations. You know that if you are exposed to sun radiation, for instance, to strong sun for too long time, it may trigger a cancer of the skin. I guess that you all know that, right? That you have to use protection because it's dangerous, you get sunburn, but not only, it's also because the radiations from the sun rays are potential trigger of cancer. Then there are chemical carcinogens, like those substances that we find in the tobacco, even pollution. So even if you don't smoke, you still can develop lung cancer, especially in, well, maybe not in Mutters where I live because there is really nobody here around, but in cities in which there is a lot of traffic, a lot of pollution, the air is not that pure, you still inhale substances that may trigger cancer. And then there are biological carcinogens, and they are those that depends on infections. So you get an infection from a virus, from a bacteria, or you get a parasite, and it might, in certain cases, also trigger this response from our body. And then there are general factors. The general factors are aging. Obviously, with the age, our body works worse, so we are more exposed to any type of disease. Obesity and overweight, apparently, according to research, make our body more prone to develop a certain type of cancer, especially those that are in organs and parts of our body that are in charge of the fat mass or the depuration of the body, etc. And then there are risk factors, like those factors that don't trigger a cancer, but put you in a condition that it's a higher risk to develop it, which is obviously alcohol abuse, tobacco abuse, a diet that is not really healthy, is related with the food contaminants, and then physical inactivity. The more active we are, according to research, the lower risk we have to develop cancer. Obviously, you have to be active in a proper way, not in an improper way, but physical inactivity, according to research, is a trigger of cancer. Really, we cannot say much about the symptoms because they are too different. There are too many. But if you go over this, you will see that sometimes it's very tricky. Depends on where the cancer attacks us. If the cancer is in a position that is particularly, let's say, easy to detect, like for instance, when you touch your body and you feel a bulb, you think, okay, what's that? And you may want to go to the doctor to check it, but some cancers, and it might be a cancer, it might not, but at least it's more evident. In other cases, the cancer is internal to your body and you don't see it. You cannot touch it. And in some cases, it develops in certain parts of your body that doesn't give you any symptom until it reaches a point that the cancer is physically just too big. So it's pushing on other parts of your body, making you feel sick. But it's very tricky because, and probably you know, it is very difficult to, unless you have regular checks and you go to the doctor, it's complicated in cases to realize if you have a cancer or not, because sometimes it looks like a back pain. Cancer developing behind, for instance, close to the spine, and so starts developing at certain points, starts pushing on our spine, and you feel like back pain. So you think, okay, that's back pain. Back pain is very common. We talk about it later. 80% of people in the world have at least an event of back pain. So sometimes it's very, very tricky. So and it's very different depending on what kind of cancer you have. If you have a liver cancer, lung cancer, skin cancer, they all give completely different symptoms. Let's go into a bit into our field. What are the guidelines? Also, as I said in the beginning, very complicated to say because it goes case by case. You have two persons who have lung cancer. One is in a stage of they take it at a stage in which is still easy to treat. Another is a developed lung cancer, and the person's reactions and feelings during physical activity are completely different. So as I say here, physical activity depends on type and stage of cancer. The treatment also is very important in this case, and the starting fitness level. Like if you have a person who developed cancer, get a treatment, for instance, radiotherapy or chemotherapy that is even stronger and never been active, will be very complicated to convince them or to make activities for them that are okay. Imagine if you've never been active and then all of a sudden you start being active even without any disorder. The first few times is very tough. For a person with cancer who maybe underwent chemotherapy, is almost impossible. So the general recommendations are, if the person is active before treatment, to simply reduce the intensity and duration. And if it was sedentary, start with very, very low intensity activities. Very, very low and very, very short. So This is a first point. So was the person active or not? So based on that, one thing is this. And then after treatment, it depends on the treatment, or sometimes it's surgery, other times it's chemo. But when the effect of the treatment are over, typically, if there are no extra issues, secondary issues, or any symptom, then any exercise is fine. Like there is no limitation. I'm telling that is very important because in some cases you have patients that tell you that they can't do certain things because they had cancer. So that's untrue unless they have a secondary issue that they developed due to cancer. For instance, cancer moved around the body and developed in another part, and in this other part is giving the person issues, or the treatment also triggered a secondary issue like a back pain, etc., whatever it is. So in that case, you have to analyze that. But if not, then any exercise. The only thing that you have to remember is that probably they will feel the effort of being active much more than before. So if I used to run 10 kilometers easily, you can still run 10 kilometers easy after you can still run the 10 kilometers after the treatment. If you were used to that, actually it's recommended to keep your habits, physical habits, but you'll feel it way tougher than you used to feel. So also when you have the patients with you, perceived efforts, and this is not only for cancer but for any disease, remember that perceived effort is one of the major tools that we have to understand how patients are coping with the activity. Okay? You know any method to understand perceived effort? Just scientifically speaking, not asking, hey, how tired do you feel? That's a practical one. But scientifically, do you know any instrument to perceive effort? To detect or to gather information on perceived effort? Guys?
Using a scale.
For instance?
RPE.
Yeah. Do you know any specific scale?
I know the classic Borg scale from 0 to 10, for example.
Borg scale, yeah. Borg scale is one of the most common. The original Borg scale, used also research a few years ago, was from 6 to 20. And then they changed it into 1 to 10.
1 to 10, yeah.
Yeah, you have an idea why they changed that? That's just curiosity.
Maybe it's simpler, easier for the patients to rate it, because from 6 to 20 you have more individual numbers, obviously, so it's harder to know where you are.
This is precisely the reason. I'm sorry?
I thought it's because of the heart rate. Then it's similar to the heart rate in which the person's in.
There are several reasons. It might be closer to the heart rate diagram in the exercises, but in this case, the main reason, in some other cases, they do make changes to scales based on the, let's say, the ability to compare it with the heart rate. In this case, the most important reason was that, as Chris said, it was easier for people to understand. Because like you ask a person, tell me from 6 to 20, how tired you are from this exercise, so how much effort you perceive you have from this exercise. And people, standard people, like normal people, unless you have worked in research or this stuff, from 6 to 20, say, what kind of scale is that? But you work on a scale from 1 to 10 always. Like it's much easier to work on a scale of 1 to 10. It's easier to understand in general for people. So it might be also for the heart rate in this case, but as far as I know, the main reason was that they used it for making it easier for people to understand the perception of effort. Anyways, both are still used, by the way, just that the 110 is now more common than the other. So some of the recommendations that the American Cancer Society gives, is one of the biggest societies that works on cancer, is to avoid inactivity. So no matter, unless there are secondary issues, unless the person is undergoing surgery, etc. But in any other case, even when they're undergoing a treatment like radiotherapy, etc., or chemotherapy, as obviously you modulate the activity based on what they can do, but avoiding inactivity would be best. And then get back to regular activity as soon as possible. First of all, after diagnosis, and second of all, after a treatment, once the body has gone back to normality, to get back also to the regular daily activities. Now, if someone was inactive before, what does regular daily activities mean? Well, we have to obviously always refer to the recommendation for physical activity in adults, which is to be active 150 minutes per week and two or more times a week of strength exercises. As long as the cancer is stable, as you can see. But so if a person was not before active, so to little by little take them to the reaching the adults recommendation for physical activity. There are several potential risks that you have to take into account. Obviously, some of those that are highlighted due to the therapy or the cancer itself is, for instance, that sometimes the therapy that they have has an impact also on other parts of the body. If you think about chemotherapy is obviously becoming more and more precise, but the main point of the chemotherapy is that it destroys everything they find on their way. It's very difficult to separate the cells of the cancerous cells from the other cells. So many times you have also other issues, because in any case you are basically putting some chemical in your body. So there are treatments that affect our lungs, our heart, and obviously they also affect our ability to be active. In some cases, there are cancer is associated with anemia, so lack of oxygen-rich cells. So obviously, what happens when we don't have enough oxygen-rich cells in our blood cells in our body? What do you think will happen? What do we need them for? What do we need the oxygen-rich blood cells for? Guys?
So yeah, so the oxygen gets transported to the different organs, or yeah.
And why do we need the oxygen?
Yeah, for the different
activities, right?
Activities, yeah, right. Yeah.
We need it for everything.
For metabolism.
Sorry? Yeah, exactly, for metabolism. We need it for everything. Now you are seated listening to me, and you are in need of oxygen for the regular activities of your body. You might be also laying on the bed and still not doing anything, and still you need oxygen. And if you are active, you need more oxygen. If you have a problem with anemia, like a cancer-triggered anemia, because the therapy is destroying also blood cells, then you have less availability of oxygen for your body. And that affects obviously your ability to be efficient, both at rest and during activity. And other related issues that may appear, for instance, osteoporosis or less balance ability, extra bleeding, etc. All these things are things that are recommended to be checked before entering activities with any patient. In practice, what do we do? So depending on the patient, right? But still, if we have a patient in bad conditions or in relatively bad conditions, even a few minutes of activity every day would be beneficial. Like regardless of, like based on all we said before, if you have a patient in the, let's say, worst condition, but still can be partially active, even a few minute activity works well. Whatever but being sedentary would work well. Obviously, the recovery times are usually longer. So if you plan, for instance, to work with people with cancer, obviously depends on the type and therapy, etc. But recovery times tend to be longer. So they need to have a longer recovery time. If you have an activity and you think that a person with healthy person would need 2 minutes recovery time, cancer person would need more recovery time than that. So you have to plan it longer. Also, something that they recommend is to alternate short activities of low impact with breaks. So I have 10 minutes, break, long break, 10 minutes, long break, 10 minutes, long break. It's called, I guess that we talked about it, they're called physical activity bouts. And there is not a lot of research on that, but it's some research in the recent years have highlighted that 10 minutes of physical activity several times a day have similar results as, for instance, the same amount, but all together in one session. So if I have 6 times 10 minutes with long breaks in the middle, and I have 60 minutes in a row, the results in terms of cardiovascular fitness, especially in low impacted activities, is very similar. So in this case, it could be easier for cancer patients to be active if they have longer breaks and 10 minutes on the break, 10 minutes on the break, etc. during the day. Usually they recommend to use the major muscles, so to work on, not to go too much in detail, but at least working the major muscle groups, abdominals, thighs, legs, chest, back. Those are the best that can be worked on because they also trigger cardiovascular resistance effect. Again, depends a lot on the patient. So, but for patients that are at risk, no heavy weights, resistant bands, maybe basic resistant bands, even no weight at all, so calisthenic exercise only with your body, flexibility every day, and also here, don't take me like literally. Warm up should be 2 to 4 minutes, but it depends a lot on what you're working with. But at least 2 to 4 minutes of warm up always, even if you have activities that are very, very easy. And then, as we said before, establish long recovery times because patients are probably feeling the effort much more than normally. And a part of it, a person who works, a practitioner in physical activity for diseases that work with them should be always flexible to understand when the patient needs more time, more than what we already planned for them. Does it make sense?
Yeah.
Do you have any question on it?
I have a question.
Yeah.
What if, for example, you do a very hard training with a cancer patient and he gets, because it is known that after a heavy training, for example, your immune capabilities are reduced in every individual, right?
Yeah, yes,
so
that's true.
What if you hypothetically do it with a cancer patient? You do very, very hard training. Could the cancer then take advantage of the situation where his immune response or his immune capabilities are reduced? Is that a risk or not?
Yes, in theory. In practice, well, what I used to recommend is that it's not that you. I don't know if in the future Chris want to become a practitioner in this area, but typically the practitioner in this area does not decide the exercise alone. Like,
yeah, I know. I have worked like.
So you know it well, no? So like.
Yeah, but it's just out of curiosity. I know you wouldn't do it in that dimension, in that intensity. Obviously, it's just like an hypothetical question. So if that would be possible, if you could then, endanger in that sense the patient even more.
Well, the immune depression doesn't last forever, right? It's more a reaction, and actually over the time is better for the immune system than bad. In the moment, yes, it's immune depressed. To be honest, I'm not sure if it would be a danger for cancer patients, because it's not that cancer patients are like, it's not that cancer cells are like organisms that think and say, oh, now the body is worse, let's attack. In some cases, Chris, is very, 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 it's a good I would say it's a good comment. In general, it's a good comment, but in certain diseases, even some that we have in this group, is actually very, very true. For instance, for patients with HIV, the HIV directly affects the immune system. Like, so if you do physical activity at an extreme level and you already have the immune system reduced the inabilities because of the HIV, that's not very smart. Because in that case, you have a virus. The virus moves around and with a purpose. We all know it now with coronavirus, but every virus has a purpose in life. It's reproducing. So they attack precisely the cells that they can see they can attack. And that's...
Well, can I add something here? Because I think that with cancer, the problem is when doing exercise and the immune system kind of decreases, the problem is to develop a further infection, like for example a flu or something that could be additional stress to the body. And I think that might be the problem here, or maybe when doing hard exercise.
That's definitely, but I'm not sure. What I'm saying is it depends also on what's the situation for your body during the cancer, because the cancer itself attacks the body, but it may attack something like, it may not attack the immune system. Like what it attacks is, for instance, the bones. What it attacks is the liver. What it attacks is the cells of another part of your body. What I mean is, it's not affecting directly your immune system. You follow me? Like HIV affects your immune system, make it slowing down. So if you have a slower reduced immune system, and you work out that way, you even make worse effect like of already an issue that you have due to that disease. Cancer put you in a position that is of weakness, but not necessarily of the immune system, of a part of your body, but the immune system may work normally for you. Obviously, again, it depends on a thing. What kind of treatment are you taking? What kind of things are you doing? You follow me? Like if I have a liver cancer, the doctor finds the liver cancer when it's not spread, it's right there. And I undergo surgery. Then after that, after surgery, when I recover from surgery, I'm just like you guys. I figure I had a cancer on the liver. Maybe I don't have even any issue or any, so it's not affecting directly the immune system. So it's not necessarily that it's not necessarily a heavy activity would make the body more exposed because of cancer. It might be because of the treatment that the person is getting. If the treatment affects the immune system, for instance, a chemotherapy affects the whole body is weaker. So it affects all the cells that finds around the body. I don't know if you follow me. What I want to say is that if that disease or the treatment that I'm using for that disease is affecting already my immune system, then it becomes a risk. If not, the risk is minimal. The risk is just as much as for us to have it. If the cancer is not affecting directly the immune system. The immune system doesn't have to work improperly if the cancer is not affecting it or the treatment is not affecting it. You follow me, guys?
Yep.
And the cancer is, so even if I have this very short effect on the immune system due to physical activity, the cancer is not like a virus that attacks the body, especially when it's weaker. The cancer is a cancer. It's there, it keeps reproducing in a certain spot, and then it goes around the body. Okay, you can use the lymphatic system, but just to summarize, if the person is undergoing a treatment, a strong treatment like a chemotherapy, radiotherapy is less strong, so it's usually less affecting, but a chemotherapy, they are in that condition. As I said, I even said it before, if you let me go back, I think I have the activities, not to start with activities at a lower level. I will see. Effective before treatment, reduce intensity and duration. So there is a recommendation actually to not be exaggerate with the activity in the beginning, because after the treatment, anyways, you're weaker. But then little by little, you can go back to your normal activities. Say that the best thing to do, and Chris was saying that you have already experienced, is that when you are a practitioner in this area, you obviously work together with other people in the health system. Like you don't prescribe an exercise therapy by yourself. You have the medical history, you have the latest results, you have discussion with the doctor, and a part of it, you have also the physical testing of the patient. Like before you start any program, you physically test the patient to see how the patient is, the condition of the patient. Physical testing doesn't mean that you put them running to test their cardio, or not only. Physical testing means everything, from body composition to other aspects that are at rest, for instance, heart rate at rest, blood pressure. So you have when you have a full idea of the patient's condition based on the treatment, what the doctors say, what your tests say, then you decide if it's smart to go into higher activity or to keep them low. Does it make sense, guys?
Yes.
Yep.
Yeah.
Gloria?
Yes.
Yes.
Anyways, cancer is very complicated because cancers are so different, and also body's reactions are different to the same cancer. You never find two persons with the same condition. Physical activity for cancer patients is basically individual planning. You go one by one. Even in a group that has the same type of cancer, you have to go one by one and decide a specific plan, very different for each of them, based on what their body says, basically. All right?
Yes.
I think that I want to see with you something that is more important. There are a couple more, since we don't have all the time in the world, because if not, we would stay here until 7, at least on my side, because I like talking about this. I don't like the diseases, but this for me is very interesting. But I want to definitely talk about something that I don't want to miss to talk with you, and the rest you can go over it at home. This is very important for me because the orthopedic, then we go back if we have time to the other diseases, but cancer is definitely the most impacting of the area of immune disorders. In the area of orthopedic, instead, we have several diseases that may be found or you may happen to work with. Those that the orthopedic diseases, or all these diseases that affect the ligaments, the muscles, the bones, the joints, in terms of injuries, in terms of development of certain kind of diseases that affect our bones, etc. Usually they affect the locomotor system for different reasons. It might be because of an injury for a crash with the car, for instance, and it can be even due to a poor diet, or it can be for inflammation, a virus, etc. So they are very, very, very wide area. So there are many, it's really impossible to list them all, but the most common, which I brought to you here to discuss, are arthritis, low back pain, and a couple more that are more common for us. Let me go over this and go directly to the point of the diseases. Arthritis is one of the most common, especially in older ages, and it's not a single disease, but there's several diseases. Again, also this is a group of diseases. Usually they are based on joint pain, so you have pain in your joints, and stiffness in your joints, and that's a sign of arthritis, even if it's not the only one. And it's an inflammation. So typically the arthritis is an inflammation of the joints that provokes pain and stiffness. So it's more complicated to move the joints that are affected. It's interesting for us because while people tend to think that arthritis is more a thing of elderly, it's also unfortunately very common in young people, depending on what's the reason why the arthritis is developed. And for sportsmen, professional sportsmen, is even more interesting, and we will reach the point in a minute. One of the things that, before we get into the reasons and this stuff, I wanted you to know is that arthritis is more common in female than in males for a certain reason, and it's opposite as cancer. Cancer is often more recurrent in males, statistically speaking, than in female. There are several reasons, but the latest research a part of the typical answer that the researchers give when they have no idea, when they have no clue. They say it's an interaction between environment and genes. Because when you hear that, it means the researcher is telling you, I have no idea, no clue what's happening. So they tell you, oh yeah, it's environment and genes. That's the easiest answer. But the latest research highlighted that apparently females' immune system is stronger and more reactive than males for a question of genes, which means I have no idea. No. It's true that they discovered that for a question of genes, like the immune system of females seem to be stronger and also more reactive. So for instance, when we have a cancer, that's a huge advantage for female, because if the body recognizes the cancer, for us males, our immune system says, yeah, it's there, take it easy. It's a problem for the Armando of the future. I'll do it later. For a female, it will go directly to the cancer and attack it. So one of the reasons why statistically males develop more cancer than females is because we have a more lazy immune system compared to them. But that is as we say, a sword with two blades. On one part, you get better statistics in cancer. On the other, you get worse statistics in arthritis. Because arthritis is precisely, in some cases, the inflammation that you get in the joints is a result of an hyperactivity of the immune system. So your immune system works too much, attacks your joints, and makes your joint inflamed and painful. And in female, obviously, females having an immune system that is way more active, that is even stronger than in men. So in that case, that's why the arthritis is one of the reasons why arthritis is more common in females. Another is hormones, apparently, but they don't know really why. The only thing that they know is that when you're pregnant and when you're breastfeeding, the hormones that you have in your body, even for a person for a female who has arthritis and is pregnant or is breastfeeding, the pain and stiffness are reduced. They say that they almost don't have anything at all. It's like getting rid of it. When they give birth or stop breastfeeding, so there are no more, those hormones are no more in the body, they get back to the arthritis in full. So they know two things so far from research. Hormones have an effect on arthritis. They don't know how, but they made the statistical association that when there are these hormones in circle because of breastfeeding or pregnancy, arthritis disappears and then comes back. And the other is that females have more cases of arthritis than males because of an hyperactivity of the immune system, like at the basic level. Sorry, guys. Like 20 minutes. Sorry, guys. It's just as I said, my wife has an health issue, so she's dealing with the kids around. They can hear them making mess. Anyways, so there are different types of arthritis. Depending on what arthritis we're talking about, the consequences and the causes are very different. One type of arthritis is called degenerative. The degenerative arthritis or osteoarthritis is a type that is very common. It's very common, it's the most common because it depends on how much we use the cartilages around the joint. You know that the joints typically are protected by, not all of them, but some of them are protected by a soft cushion, the cartilages. It can be a meniscus, it can be other type of cartilages, but usually they have these cartilages that the main reason why they exist is to avoid the bones to rub into each other, against each other. Because if they do, of course, it's painful and they destroy the bone. You see me, right? You see me, also me. Mm-hmm. So when the bones are in contact and they do this, they get painful and they get obviously destroyed. So the cushion avoids this contact. Why are osteoarthritis more common than the others? Because unfortunately our cartilages degenerate over the time with aging. So in many cases in which you hear that some elderly had to undergo surgery to change their, to remove to put, prostheses on some part, especially hips, especially knees, many cases is osteoarthritis due to aging. Over the time, that cartilage becomes smaller and smaller, thinner and thinner, and doesn't work anymore. But this is also a problem of high performance athletes. I don't know if you noticed, but statistically speaking, what the injuries that or the issues, physical issues that high performance athletes have at the age they have it are not that common, like for normal people, not people who use their body normally. And I'm not talking about people who are active or inactive. A person who's active daily in a proper way, they are fine. But when you're talking about a high performance athlete, you're talking about someone who's taking their body to the extreme and even over that. And so you overuse your bones, you overuse your cartilages, and there is a double effect. The secondary effect is that your cartilages are getting worse and worse over the time. The typical example that I bring in this case, and that's because I was a tennis player, is Rafa Nadal. Do you know who Rafa Nadal is, guys? You ever heard Rafa Nadal?
Yep.
So Rafa Nadal is now he's 32 probably years old. Ever since he was 26, 27, he had knee joint issues. But knee joint issues that typically you find in a person of 60 or 70. It's because, and if you know Rafa Nadal not only by name but also by the way he plays, he overuses the knees. He's really on the court. He's a beast. He runs everywhere. He does a lot of extreme physical activity to perform that way, and obviously that affects his cartilages, especially on the knees, because the knees are a part of a system that support the load of your body. So it's not only aging, but also the way you use your body and the ways you load your body may affect, may trigger the osteoarthritis. Then there are other types. The inflammatory is that precisely in which females are more affected than males. The inflammatory is based on the immune system, our own immune system, attacking the joints for no reason, for no apparent reason, and it doesn't stop. It continues, and in the end, it provokes inflammations where it attacks the joints. The most common are the rheumatoid arthritis. I'm sure that you heard that, and the psoriatic arthritis. They are the same stuff, just that they call them in different ways because of the effect on the body. The psoriatic arthritis affects both sides of the body, left and right. The rheumatoid arthritis typically attacks only half of the body. So you have it mostly on the left or mostly on the right of your body. And then also where, like, they don't really know why they target those joints, but typically the psoriatic arthritis attacks these joints. If you can see me, guys, they are mostly these joints on the finger, this.
Yeah.
The rheumatoid arthritis, the knuckle is here.
Okay.
The rheumatoid arthritis attacks more often this and the knuckle and this. So for some reason, the psoriatic and the rheumatoid attack two different joints in the end, but the effect in the end is the same, that difficulties in grabbing and pain and stiffness in the end, just that they attack different joints. And psoriatic is bilateral, rheumatoid is mostly one-sided. Finally, don't think about arthritis as thing that just happen in our joint, but arthritis have secondary consequences. Have you ever heard about psoriasis? Psoriasis is a disease that is in which you start sort of wounds appear on the skin, in some parts of the skin, and this may be provoked by psoriatic arthritis. So the arthritis is not the overreaction, the inflammation does not only affect the joints, but also the skin, provoking other type of diseases. Wait, I have a chat, but I cannot read it. Okay. I had a message, sorry, from one of you guys. Is that for me is also new, this stuff. Every now and then I don't know what I have to do. So the psoriatic and rheumatoid, they have this difference, but they are both the same family. Hyperactivity of the immune system.
May I ask something?
You can.
I didn't. I don't know if I did understand correctly. The rheumatoid arthritis is affecting only one side of the body.
Only one side, and the psoriatic, the two sides of the body.
And why?
It's interaction between environment and genes.
Okay.
You don't know.
Exactly. Honestly, obviously I didn't make research myself on this specific area. I'm more on the area of obesity in my case, in terms of research, obesity and inactivity. But I made research. I always make research also to give you all the answers that I can. But unfortunately, or fortunately, because we have still a lot of research, there are something that research may have not responded yet, because our knowledge of genetics, our knowledge of certain things is still below. But maybe you can find it in your article review and tell me. For instance, I found very interesting in the article reviews now that I mentioned it, that the typical recommendation for hypertension is not to do isometric exercises because of the increase in the pressure of the blood. But some of you uploaded an article that was saying that the isometric exercise was having a good effect on that. So you always discover something new. That's the good of research. Like the latest research always writes something different on that. And that's why it's interesting also for me that you do that, because you bring things that I might oversee. So I don't know, but I can give you that task for the article review. Find out if there is an answer. But that they have this difference, but not other differences. They are all the same process. Just that. Also, another question that would be interesting to respond is why that joint and why the other joint. Like how's the process of selection of the joint for the immune system? So. Yeah. Going into the others, there are the infectious that are provoked by certain viruses or certain organisms that we get from food or other ways. For instance, salmonella is not typical, but can be taken through mayo, just to make an example, from raw eggs. And if you're unlucky, you have salmonella. Typically, you don't have anything. You just have you're a bit sick, but then you get rid of it. But in some cases, it might trigger arthritis or other, like hepatitis or chlamydia too. Not very common though. And another is the metabolic. If you ever heard about the gout attacks are moments of extreme pain in certain joints. And in a certain moment, all of a sudden, you have this pain, and then it goes away, and then it comes back over and over again. In some cases, when you have an excess of uric acid, so related to, for instance, kidney disease, that the kidney doesn't work very well, or liver disease, they don't work very well in cleaning our body from these toxins. So you have uric acid around the body, it crystallizes, so from liquid it becomes a crystal, so actually solid. It goes around our body through the blood system. If we have a kidney disease, it's not cleaned up by the kidney and ends up on a joint. That's mechanics. That's nothing weird. Like when you have a joint doing its work, and then all of a sudden you have a piece of something that entered the joint. That mechanism, the joint cannot work anymore very properly because there is something there in the middle that blocks it, and the part is painful. And it goes away because the crystal may not get stuck in the joint, but may go away and continue and end up somewhere else. In some cases, it stops there and provokes constant pain. Does it make sense?
Yeah.
I see only few of you because I have the presentation, but I will take you as a sample for everybody. So you are the representative sample for the rest. Since all of you are doing yes, I suppose that everybody is happy. The causes may be very different. So as we said, osteoarthritis, injuries, overuse of joints, like in sports, when you overuse them, in inflammatory, it can be, in the infectious, it can be a food poisoning or dysfunction of even of the immune system. And finally, the metabolic is typically, as I already said, kidney failure. So kidney is not able to clean our blood from these particles, and these particles end up in the joint, provoking the problem. Some of the risk factors are family history, aging, as always, gender, as we said, females are more exposed to that, and also if you have a medical history of injuries. If you have repeated injuries on a certain part of your body, for instance, repeated injuries on your knee, like soccer player, many injuries on their knee consecutively, affecting the meniscus. 1, 2, 3, 4, 5 times, the meniscus, bye-bye. Osteoarthritis more possible. So also the history of injuries and obesity. Obesity for a very simple reason. What do you think is the connection between obesity and osteoarthritis?
People stop moving because they are in pain.
Well, because when you move, you are moving extra load. So you are actually loading your joints more than you should. And that affects obviously your joint and the cushions also. Another reason, if you remember, those who were there with me, if you remember what we discussed about obesity, what could be another reason, for instance, between obesity and inflammatory arthritis, like rheumatoid and this stuff? You remember what we discussed last time? We said that obesity provokes, releases adipokines. Remember what adipokines are for?
What?
For anti-inflammation, or not?
They trigger inflammatory process to react to fight against some problem that we have in the body. So they are actually creating the inflammation, but only for a short time. As long as we have a certain issue, we remove that issue and bye-bye. But in obesity, what's the problem? The problem is that we produce too many of those adipokines. So researchers discovered that people with obesity, chronic obesity, they have a chronic inflammation. Like not very high inflammation in the body, but a chronic inflammation. So over and over the time, they are inflamed. And that may trigger also arthritis, because that inflammation is somewhere in the body, right? It's not it's in an unknown point of your body. It must be somewhere. So that inflammation may eventually affect also our joints, provoking an arthritis. The typical symptoms that you have, well, the most common is stiffness, pain in the joint, etc. Range of motion that is decreased, so you cannot do the full movement of your joint. In some cases, you have the skin that is completely red, so redness of the skin. Sometimes is the joint that is affected is swollen, and all around the joint you find swollen part of the body. And then, as I said, it can some of the types can affect also all other organs. For instance, the psoriatic affects also the skin, but it's not only that. It may be other organs are affected by the same thing that is affecting the joints and giving us other types of issues. On the exercise, the most important thing that you need to know is that for the exercise, we have to work a lot on flexibility, obviously. Actually, they say to do it several times a day. 5 times a day would be ideal. In the morning and in the evening before going to sleep, that would be even the best. Like those 2 times at least in the morning, because when you get up, It helps reducing the stiffness for the day. Usually when you do it immediately after getting up, it helps a lot for the daily, for bearing the daily pain and stiffness. And before the night, before going to sleep, because it seems to help overnight, and so helps also have a better morning the day after for those joints. But 5 times a day is the recommendation. Short flexibility, never reaching pain, always within the range of motion that is allowed from the arthritis, not more than that. So don't overgo that. If the person feels pain after a very small flexibility exercise, you stop right there. You don't go into pain. Pain is bad, but several times a day. And then the other thing is, well, there are several, but I want to also discuss very quickly low back pain. So the other very important thing is activities that keep those joints working. The typical activities, especially for the most common problems like rheumatoid arthritis, the stiffness in the hand, activities that imply grabbing stuff. Like it can be anything from have you probably heard the boiling potato? So a stupid exercise as a boiling potato game could be. Are you familiar with boiling potato game?
Yeah.
It's like there is music, you are in a circle, and as the music goes, you have to toss a ball to someone else, and the other has to grab the ball and then toss it to another. And when the music stops, the one who has the ball in the hand has the potato boiling in their hand, and they get burned. It's a very stupid game, but you can do it, and it works pretty well for grabbing and keeping the stiffness, reducing the stiffness, because you can do it like we have done it actually in the past though, and it works wonders with different balls. So you have to grab different things with different balls, not only in terms of size, but also texture, foam balls, other types of balls, soccer balls. So bigger, smaller, you can work pretty well, and then you can do many exercises. You can do, for instance, the tossing can be from the up. So you're working on the joint of the shoulder and on the grabbing. You have to grab with the left. You have to grab with the right. You have to. So you have 1,000 of variants, and usually it works well. But any type of game or exercise that you can think that help people doing this movement of grabbing and keeping the joints working would work perfectly. In other cases, osteoarthritis. Completely different case. Osteoarthritis of the knee. What do you think you should avoid if you have an osteoarthritis, a patient with an osteoarthritis on the knee? So meaning that no more meniscus. What's the recommend? Huh?
Swimming. Swimming is good for the joints, or cycling is better than running. It's less pressure on the joints, or yeah.
What should you avoid?
Avoid? Oh, sorry.
No. Very, very good actually. Swimming, and actually, I will ask you another question after that on swimming. But and it's very true. Swimming is good, or activities in the water. And what should you avoid instead for that type of?
You should avoid resistance training, doing squats, heavy squats with weights, deadlifts, all this type, or running on the street without good running shoes. So you need a Federung. I don't know the English word.
Yeah, very true. So the main recommendation is avoid overloading that joint. So in the case of the knee, with osteoarthritis, you don't do exercise with weight. It's not that you can't do squat, but you have to do it in a way that does not overload too much the joint. Like don't do it with weight on you, don't do it too low, etc. So the main precaution is no extra weight, because that would increase the osteoarthritis rather than reduce it. And a quick question on water activities. What do you think would be good? Warm water or cold water? It's for everybody, right? Not only for Christoph. But if you have an answer, Christoph, go ahead. I'm just saying that I'm not.
I think that's a difficult question because always when I feel pain, I don't know, after training or something happened, with a joint, then I always pick, I don't know if I use heating cream or Voltaren, and so that's a good question. Yeah, I'm looking forward to the answer.
Typically, you're right, but it depends on the nature of the problem. Like in the case of arthritis, regardless of the type of the cause of the arthritis, there is an inflammation in there. So it's they say that at least research says that in the case of arthritis, cold water is not good because you have stiffness of the joints and you have pain, and apparently due to research, when you do it in colder water, that increases the stiffness and increases the pain. And in warm water, not warm, let's say normal temperature water, like I cannot tell you how much, but not too warm, but warm water in general is better according to research. You can look up the articles. I remember that it's not long ago, I think 2018, 2019, they had some research on that, and they were mentioning that cold water is worse than warm in this specific case. But then, as Christoph says, you have to check what's the reason of the problem, if it's arthritis or not, because a joint pain doesn't always mean arthritis, and then decide what to do if you do water activities. But water activities are recommended for arthritis. Let me tell you one thing that I consider interesting and you won't get from the slides before we close, not on arthritis, but on low back pain, which you have it also here. You won't find it here, but it's something I've been working in the last few years with some personal trainers in gyms, etc. And when you have low back pain, first of all, as I said, 80% it's considered an orthopedic disease, but you have to be careful in classifying it in terms of, if you have low back pain today, you are one of just another 79% of the human population that suffer acute back pain. That's normal. 80% of people, 2 people out of 3 in the world have had at least an event of back pain. When we talk about lower back pain, we talk about, as a disease, is a chronic lower back pain, meaning that it lasts longer than 2 weeks, a month, and nothing, no medicaments, no ointment, nothing, no resting helps reducing it. Actually, for a chronic lower back pain, despite the myth is that you need to rest because you have back pain, it's the opposite. Research says that if you rest, you make it worse. So you have pain, you work out. Sorry, guys. Sorry, you have to tell them, guys, sorry, you have pain, then you have to work out more, so you have less pain later. So the myth is no workout stop until the pain is reduced, then you don't stop forever because the pain will never be reduced. So, but this is not what I wanted to say. What I want to say is that one of the main things that you have to do in low back pain as a recommendation is core strengthening. So strengthening your core, your abdomen, your back, but there are different strategies for doing that, and there is some definitely that is bad for low back pain, and other that are very good. I don't have lower back pain, but when I train myself, when I do abdominal strengthening, I use that technique because it's much more efficient than the regular techniques that you know. What do you think about it? You have a back pain, so a pain on your spine, on your back, and you need to do abdominals. What kind of abdominals would increase the pain? What do you think? Which ones? Not the exercise specifically, but the type.
Abdominals with flexion and rotation, for example.
Flexion, well, most of them, but most of them are with flexion, but rotation. Why rotation? Because rotation of the spine increases the pressure on the spine. If you have a pain on the spine and you do the rotation, is increasing the pressure on that, increasing the pain. So yeah, you have to work out with pain, but you don't have to increase the pain, right? So rotational abdominals are actually not recommended in general. Like what they say is that you do rotational abdominals, but you know how much percentage of abdominals are you using compared to other muscles of your body? It's very reduced. So you're working out your abdominals, but not really as much as you think. There are other muscles that intervene in a major way in the rotation of the spine that don't have anything in common with the abdominal. So you're doing two things. You're doing rotation, you're increasing the pressure on the spine, which increases the pain, and you are not even really working the abdominals. You're working mostly other muscles. It's just like for the flexion. As Chris said, there is a certain flexion until 45 degrees. From 0, when you're laying, you reach 45, and you're using mostly abdominals. When you do 45 to 90, the iliopsoas muscles that intervene mostly and in part, but a very reduced part compared to from 0 to 45, also the abdominals. So one of the recommendation is no rotation, and the other recommendation is up to 45 and back, never over 45. So you reduce the flexion, and the part you focus mostly on abdominals, because after 45, again, there are other muscles that majorly intervene in the flexion that are not anymore the abdominals, but the iliopsoas. And so how do we work out all the abdominals? Because as you know, there are many parts, many fibers of the abdominals. There are the oblique abdominals, the diagonal abdominals, lateral abdominals. When you do the flexion, typically you work mostly the central abdominals. You know what's the anatomical function of the oblique abdominals? So those that we have on the sides. Does anybody know what's the main function of those abdominals? Guys?
Lateral flexion.
Yes, as I say, they intervene in the lateral flexion partly, but they are not the only muscles, because there are also the quadratus lumbi and other muscles, but they have another main function. Even major function. I'm sorry?
Breathing?
Correct.
Aren't they?
What? Sorry?
Breathing. Breathing,
okay.
Yes. The lateral abdominals are connected to our thorax, to our ribs.
Yes.
So they don't intervene all the time. Like when you're breathing normally, they're not really working that much. But if you try to do this, try until you don't have any more air in your lungs and check what's working out. The abdominals are pulling down the ribs to increase the space, the pressure for forced expiration. So actually one of the main functions of the abdominals, the side of the lateral abdominal, is the forced expiration. You can try now, right now. And the abdominals are working. Those specifically, those ones. So if you have time.
Question. What is the reason of the low back pain? Is there?
There can be several, but there are two major causes. One is physical, and the other is from the nervous system. In the case of the nervous system, is when the nerves that go down from the head to the body, that are in the canal, in the spine channel, in the canal, for some reason get impinged. Like for instance, in some cases there is a narrowing of the spine canal, or some vertebrae that have some problem and slide over each other, etc. In that case, there could be the pain may be due to the nerves. In most cases, it's physical. Physical is muscle strain, ligament strain, etc. Then there is a very, very small percentage of cases in which low back pain is due to completely different thing. For instance, a kidney disease also can provoke it, or a cancer close to that zone also can provoke it. But the major cause is mechanical, muscle strain, ligament strain, etc. And so, as I was saying, and to conclude this, if you have time and willingness, try try to do the abdominals. And every time you go up, you can do regular abdominals. For instance, what I do is I put my legs up. So for instance, I have a Swedish ball, those big balls. I put my heels on the Swedish ball, the knees slightly flexed, and then I go up to more or less 45. And while I'm going up, I'm exhaling. If I reach 45 and I still have air, I stop there, keep the position of 45 degrees and keep blowing out air until I'm done. When I don't have more air, I go back, inhaling, and then over again, and again, and again. I can tell you that I used to do, when I was an athlete, I used to do even session of 900 crunches. And with this activity, after 60, 90 that I do, I'm dying because all my abdominals are working out at the same time. So you are working out the central abdominals by flexing, and you're working out the lateral abdominal by exhaling. And exhaling is very efficient for making the abdominals work. If you have time, try it because it's really interesting and you can feel it on your body. For a person with a lower back pain, a chronic lower back pain, that's the best way to work out their core, at least the front part of the core, because you avoid the extra pressure that derives from the torsions. But to be completely honest, I work in health and I suggest this type of abdominals to everybody, regardless of the lower back pain, because the torsions are in any case unhealthy for your spine because they increase that pressure on your spine. Do you have any question? Wait a second. Huh?
This is precisely what you mostly see in gyms. People go there because they need to lose.
Since my wife is giving me hints. She said because she works also in health, and she's saying that this is the typical thing that happens when you go to the gym and you see a lot of people that work out abdominals in a certain way. And
I wanted to tell you that most of the coaches, like the gym we go to, for instance,
why aren't you sick?
They go,
my wife is.
They do the abs and for health, right? And most people who go to gym, they go there because they have some health issue, they need to lose weight, but these are precisely bad exercises for them, and all the trainers.
Yeah, what she's saying is that, sorry, but she works also in health, so when she hears that, she wants to intervene. She's saying that because if you go to a gym, you typically see those exercises that every time I go, I used to go to Happy Fitness, and every time I go there, I can see these people doing these extreme abdominal exercises, but in a way that is really dangerous for their spine. Like you don't need to do anything like super weird, like pulling 300 kilos down or things like this to improve your abdominals. If you do, according to research, if you do 5 to 10 minutes abdominals every day, not more than that, you keep your abdominals like in a, let's say, Thor shape. Thor from the movie Marvel, right? If you do them well, obviously. But if notice that when they reopen the gyms, like those who mostly do that type of abdominals are part of the more risk for the spine. Many of them, not all of them, they have a bulk. They have a bulk in the belly rather than have flat belly. They have more a bulk, which is abdominals. It's not fat, right? But it's because they work mostly the central abdominals and not the sides abdominals. And respiration helps you having actually a flat belly but strong, and at the same time reduces the risk for the spine. But if you have time and really you want to try it just once, if you work out at home, try it because it's really interesting. Remember, you keep 45, blowing out. When you reach 45, if you still have air, stop, continue. When you finish the air, back, inhaling, and over again. Let's see how many. Let's open an abdominal challenge. Let's see how many you can do.
Do you go all the way down when you exhale, or do you just lower your shoulders and then go up again?
No, you go down with your back, not touching the ground, but low down until a certain, like this far from the ground, but not touching the ground. So down and then up again. Any other question? Any other? Do you have any question on that or what we said so far?
Is there too much? Because there are cases of lower back where they did too much strength training or wrong strength training, and they had a little. If your muscles around your sore area are too strong, it gets a little more compression on the injured area. So would it be better then to do more stretching to release this area?
No, one of the major problems in this sense is that people think that core exercises are only abdominals. But that's not true. The problem of doing only abdominals is that, as you say, abdominals become very strong. So they are pulling you, they are pulling you, like they are not forcing you, but they are pulling your body to flex forward. And if you have too loose muscles behind in the back, then there is a counter reaction of the body, and it's worse because it creates precisely a unbalanced situation between front and back. In some cases, you have even a counter effect that the muscle of the abdominals become loose because you cannot stand that pressure. But the main problem in this case, as you ask, is that people tend to think that the core is the abdomen. So if you work out obviously you have to work out like 500, 1000 abdominals per day. As I say, 5 to 10 minutes abdominals every day, together with back exercises. So to keep also your back in tone, not strong, but in tone. Keep the balance and avoid this pressure that you're talking about. But most people don't know it. They think that they need to have the super abdominal with the six pack, and then they forget that they also have a back that needs to be worked out precisely for this balance thing. That's why we exist. That's why we study and we go out there to tell them. So no, of course, don't overwork out with them, but with exercises for the core and flexibility, that works perfectly. And then the other thing that you do is there are many exercises for releasing the back pressure. For instance, the Swedish school has exercises, the German school has exercises. Some of them, I'm sure you know them already. Like, for instance, when you lay and then put your legs up. So you lay with your back close to the wall and the legs up, and then you do exercises for the sensibilization of the hips and the back, so up and down, etc. These are exercises that obviously everybody should do in these cases.
Yeah.
Sorry.
McGill also did a lot of research in this area and described some very well-researched exercises. So if you want to look that up, some of you, I guess maybe you know him. It's McGill from the University of Waterloo or something.
I don't know him. I mean, I know McGill, but I don't know him personally. But anyways, as I say, I cannot know everything. Like nobody can know everything, and sometimes you bring guys articles or things that are very interesting to read for me, because actually your review exercise for me is more is very interesting, because some of you have found articles that bring up other things or this stuff. So if you know the author and he has recent articles and you want to share with us, or even if he doesn't have recent articles and you want to share, go ahead and do it, because we all learn from this.
He's really good, Dr. Stuart McGill. I can share. Yeah, I have his book as PDF file on my computer. I can send it to you, Armando, and you can put it up online.
Yeah, do it, please. I'll do it.
Okay. Or I can do it. Yeah. Yeah.
No, if you send it to me, I will upload it in useful files in OLAT for everybody to see it. Thank you.
All right.
Right, guys. So if there are no more questions for now, I would close it here. The file is already there in this PowerPoint was already there in OLAT for some times now. Today I will upload the following one, neuromuscular and cognitive, and the next week we discuss it. And from now you can work on these. You can find any 2 reviews of articles on this field until the next week, and so on. Is that everything is clear in this sense?
Yeah.
Yeah.
Still reading your articles because it's interesting but takes time, but little by little I will send to you everything, every comment I have. You saw anyways my first comments. Pretty much everybody had good works, and it's clear. Just some of the probably things that were less clear is the variables that are defined. Usually by variables we intend those that the study wants to assess, measure. In some cases there were confusion because it's difficult to, but check always the objective of the study. In the objective, usually the variables are described. I want to assess the effect of that program on, I don't know, stress and metabolism of triglycerides. So stress and metabolism of triglycerides is are the variables. But you had all good jobs, like you are experimental researchers, I guess. So there was not not major things. Just please, if you missed something from the reviews before, upload them still. Even if you have missed some of the reviews that were supposed to be done before, please upload them now or upload them as soon as possible. So don't leave it behind. Okay. Okay, guys, I will upload this recording also, and I will put it in OLED, and then as always, I will send you one of my boring messages in which I tell you 20,000 things, including that I uploaded the video and I uploaded the presentation. So you can start reading on them, and if you want to do the review activity already, go ahead and do it. Okay?
Yeah.
Yes.
Yeah.
Thank you for dealing with me this 1 hour and a half. And I'll see you next week. Write me if there is anything, please. Okay? I will stop sharing so I can see you all. There you are. So thank you guys from San Francisco. Stay healthy, and I'll see you next week.
Bye bye.
See
Bye.
you.
Bye guys.
Peace.
Bye-bye.